All right, aloha everyone. We're going to go ahead and get started. Thank you for joining the COVID-19 Public Health Action webinar, How to Control the Coronavirus and Bring Back Hawaii's Economy. My name is Steph Moyer, and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. Before we get started, I just want to go over some Zoom housekeeping. For all questions, please utilize the chat box or question and answer box located at the bottom of your screen. We will not be offering any continuing education credits for our COVID webinar series, and all webinars are being recorded and will be available on the Hawaii Public Health Training Hui's YouTube channel. I will be serving as your moderator for today's webinar, and it's my honor to introduce you to our guest speakers today. Dr. Tim Brown is a senior fellow in the research program at the East-West Center. His primary focus is on infectious disease modeling and its application to public policy. He currently works for UNAIDS, Global Fund, Avenir Health, and other global and national partners to develop estimation and projection tools and methodologies for countries, implement more comprehensive policy analyses of HIV epidemics and effective responses to them, and supports the development of improved strategic information systems in Asia and the Pacific. Our second speaker for today is Dr. Sumner LaCroix, and he is Professor Emeritus at the University of Hawaii at Manoa Department of Economics and a Research Fellow with the University of Hawaii Economic Research Organization. His research focuses on the economic history of Hawaii, institutional change, property rights in land, intellectual property rights, and labor markets in the Asia-Pacific region. He is on the editorial board of Journal of Economic History, is an executive editor for Journal of Asian Economics, and an associate editor of Asian Economic Journal and Australian Economic History Review. His new book, Hawaii, 800 Years of Political and Economic Change, was published by the University of Chicago Press in March 2019. So without further ado, I'm going to turn it over to Tim, who will be our first speaker.
Okay, next slide, please. Okay, as many of you are aware, Sumner and I basically wrote a report about a little over 3 weeks ago now that was a 4-step plan for getting Hawaii back in business after our coronavirus shutdowns. The first step was to stem the influx of new infections. This was accomplished with the travel ban that was put in place in late March. To slow the spread in the local population. This has been the primary focus of the stay-at-home orders, social distancing orders, and requirements for masks in public. And then to set up a strong system for testing, tracing, and isolating. And then finally, to monitor the epidemic and then gradually relax these restrictions when the conditions allowed. Next step. So we've been closed for a month and a half now. What have we actually accomplished? Well, this slide shows you the weekly average of daily COVID cases. Basically, it's looking at the average over the last week of the number of cases diagnosed. And you can see that the lockdowns basically initiated here in March, and that's shown by the red arrow in the figure. And 2 weeks later, we actually see a turnover, and we start to see a decline in the average number of daily cases being diagnosed. So in fact, the stay-at-home order has had the desired effect, and at about the expected time, roughly 2 weeks, which is the normal incubation period of the epidemic. So in fact, I think Hawaii can give itself a big hand that people obeying these orders have actually accomplished a great deal in the last month or so. Next slide. There is definite evidence that behaviors have changed in Hawaii. Google prepares these community mobility reports. They don't exactly define these metrics particularly clearly, but what they're looking at is compared to the baseline, which is people's average behavior, how much has there been a decline in the use of retail outlets, restaurants, theme parks, and so on. You can see this has gone down 55%. In fact, if you look, the center point on these graphs is Saturday, March 21st, which is about the time that our lockdowns actually began. And you will see that people had actually begun staying at home and increasing their social distance prior to the orders actually coming from the political side. So in fact, the changes in behavior actually occurred prior to that. You can see a major decrease in transit use, decreases in workplaces, and so on. So we've had the desired effect. We basically have kept people at home. We basically have reduced mobility in the community, and that has helped to drive down transmission, as we saw in the preceding slide. Next slide. Now, the other thing that we've noted, and it's a rather interesting pattern, is that the transmission has shifted from travel-related transmission to community transmission. The blue bars on these graphs basically show you the travel-related transmission. So you can see if we look at mid-March, the vast majority of transmission in Hawaii was travel-related. But as we shift into April, you'll see the travel-related has been cut off substantially, basically by the travel bans that were instituted in the 14-day quarantine order. And we see that the community transmission has become a much more significant component of the overall epidemic. But with that said, the numbers are still going down. So overall, we've seen about 37% of the transmission is community related. But if we look at April alone, almost 70% of that was community related. But again, the numbers are falling. So we're having the desired effect in reducing the epidemic. Next slide. Now, we listed 4 criteria in the report in order to start doing a phased reopening. The first was a sustained reduction in new cases for at least 14 days. We pretty much have satisfied that at this point. We're now down in the seeing 1, 2, 3 new cases per day sort of fluctuating phase, and that's probably going to go on for some time. The second condition was that the hospitals in each county can safely treat all in need. We've actually stayed well short of maximum utilization of our hospitals. We've never even exceeded the 50% point in terms of hospital beds, and I think no greater than 20% of ventilator use. So in fact, we've done quite well in that regard. So that criteria is met. The third is sufficient capacity to test all people with symptoms. This one is very obviously still a work in progress and something we will talk about more during this presentation. And then having the capacity for tracing all close contacts of anyone testing positive, for active monitoring of isolation for those who are positive and for their close contacts. And that we haven't yet achieved. And finally, we would propose to update these by extending those 4 conditions with an additional capacity, first for active surveillance of COVID-19, something that is not yet in place. And second, actively monitoring the quarantine of all visitors and returning residents. Next slide. Now, some are wondering, okay, we've more or less satisfied some of those conditions. Yeah, we've got some work to do on testing and contact tracing, but why can't we just reopen today? The reason we can't is because this virus is extremely contagious. This thing spreads very, very rapidly. This graph shows you one of many, many clusters in Singapore. This was a cluster around a single private dinner function that produced 47 infections. Okay. And lest you think that, okay, that can't happen here in Hawaii, look at the Maui Memorial Cluster. As far as we know, so far we've seen 57 cases associated with that, and those are the ones we know about. The Kona McDonald's outbreaks, we've seen 36 cases associated with that. So these clusters can grow very, very rapidly. And prior to those clusters breaking out, both Maui and the Big Island had comparatively low numbers of actual infections. So in reality, this thing can spread very, very rapidly, even under the conditions prevailing in the islands. And we were definitely too slow in responding to these outbreaks. Next slide. The potential for rebound is high. So if we look at, this is a group called COVID Now that basically prepares projections. They project that if we were to lift all restrictions right now, go back to the way it was in January, February, we would see 13,000 hospitalizations by June 1. So the potential is still here for an extremely rapid epidemic, and we need to be concerned about that. Next slide. Now, New Zealand, which is a place similar to us, it's an island nation with a population of about 5 million compared to our 1.4 million, so a little bit larger than us. But they've come up with an elimination strategy, and in fact, they declared it eliminated last week, which means that they're only seeing 2 or 3 new infections every day. In fact, that's what they've seen in the last 2 days. they had 5 steps to that. First was border controls with high quality quarantine for travelers, rapid case detection based on widespread testing, followed by rapid case isolation, swift contact tracing, and quarantine for contacts, intensive hygiene promotion, a lot of hand washing. They didn't include use of masks, but I would add that in here. Intensive physical distancing, which they implemented as a lockdown, just like we did. And a well-coordinated communication strategy to inform the public about control messages and what they need to do if they become unwell. And I now want to go through these 5 steps and talk about where we stand. Next slide. High quality quarantine. Okay, I think we're all quite aware there are still some major issues with getting people, incoming travelers, to respect the quarantine. We're also very concerned about continuing incoming travelers without adequate controls on this. So this is an area we need to work on. Widespread testing. While we have higher testing per capita than many states in the United States, we do not feel that the testing currently covers everybody it needs to. Swift contact tracing and quarantine. Again, there are issues here in terms of capacity and the ability to deal with it. Provision of hand hygiene facilities in public settings. Again, I think we're running into problems there. When I went to the supermarket a couple days ago, they no longer basically had the handy wipes that they used to be giving out for wiping down your carts and so on. So there are challenges, I think, in terms of getting the supplies out there. We need to plan how we're going to relax these measures, and we haven't yet done that. That's a work in progress right now. And finally, we don't have a well-coordinated communication strategy. In fact, I wouldn't even say we have much of a communication strategy at all. Next slide. So what do we need to do to prepare for reopening? First, we have to be able to rapidly identify any outbreak through testing and surveillance. We have to have the ability to quickly crush any cluster that starts to grow, and we need to have the full support of the public in order to contain further spread. Next slide. Okay, what do we need in terms of testing and surveillance? Our testing strategy needs to be systematized for rapid detection. Right now, we have a rather ad hoc collection of testing strategies that are going on, no coordination among the different groups, and as we've seen, and if you've been paying close attention, there are even conflicts in terms of who's doing testing and should they be doing testing and so on. So we definitely need to coordinate this. We need to build a rapid turnaround testing capacity on island. That we've made significant progress on. And finally, we need to be testing everybody with COVID-like symptoms. We also need to anticipate the epidemic. So we need surveillance in healthcare settings, nursing and long-term care facilities, and in prisons. There's just a story today about how 40% of the inmates in some of the prisons in California are now COVID positive. There's also an interesting thing that's come up recently of testing wastewater, because there is fecal shedding of virus. And so you can actually test wastewater. In fact, there's a company that came out of MIT that actually does do this and offers it to states right now on a testing basis. Next slide. If we fail to do this, we could end up like Singapore. Singapore went from more or less total containment of the epidemic, with having only a handful, a few cases, 40, 50 cases per day, to 500 to 1,000 cases per day, because they basically failed to anticipate dorms for migrant workers. They did not test in these dorms. They did not take steps to ensure safety in these dorms, and that let their epidemic get out of hand very, very rapidly. And you can see the growth of the number of new infections per day, or number of cases per day, that are shown in the graph here. They grew extremely rapidly from very low levels to very high levels. Next slide. In terms of crushing epidemic growth, the real key here is contact tracing. As soon as we see one of these clusters start to form, we need to stamp it out. The current system is way too slow. We definitely have capacity constraints. We're told the system is still using volunteers. A single person may have 20 to 40 contacts that need to be traced. And we really need to have a target of same-day reach. Every additional day that we do not track down the contacts is an additional day for coronavirus to spread in the community. We also need to take advantage of some of the emerging e-technologies, the new Apple, Google app, which will be coming out shortly, things that MIT have done. There's a COVID Trace app that's being used in Australia. And finally, we vastly need to improve our quarantine and isolation monitoring. We're not doing a particularly good job on this, and I think we really need to improve it. Next slide. Finally, we need to engage and enlist the public. My personal assessment is that the state's communication on the COVID situation has been poor. While we have daily press briefings and so on, that doesn't get the message out to the public. That only reaches the people who are willing to sit through an hour to an hour and a half press briefing to try to glean some information about what's actually going on. We need a clearer communication strategy. We need public service announcements. We need ways of informing the public so the public fully understands, number one, we're in this for the next year or two. This is not going to go away very quickly. When we start to lift the restrictions, this is not over. We will need to continue social distancing. Every member of the public has a role in protecting the vulnerable. And we need people to understand why quarantining themselves is a social responsibility and why masks in public are an absolute necessity. Next slide. So what should we expect from government? First, we need a cohesive testing strategy that can do rapid testing. We need contact tracing capacity so that we can stamp this thing out before it even gets started. And we need a carefully crafted plan for reopening safely. And we also need to anticipate any legal issues or challenges on things such as self-isolation or quarantine. And the Attorney General basically needs to be preparing for these things beforehand so that it doesn't spring some surprise on us suddenly that doesn't allow us to do the things we need to do to contain the epidemic. And finally, we need much more transparency and public communication, both on what's going on and what's being done basically to address the epidemic. Next slide. What should we expect from ourselves? First of all, we have to accept the new normal gracefully. Social distancing and masks are going to be part of our lives for the next year or two. If we're exposed, we have to know that it is our responsibility to isolate ourselves in order to protect our families and friends. We need to hold government and businesses accountable for their responses. Where we've seen failures to use PPE in public healthcare settings, the worker associations, the unions, and the public basically need to step in and make sure that proper precautions are being taken. The public and civil society groups need to work to improve safety, access to healthcare, and income for frontline workers, the homeless, and prisoners who are at extreme risk of this. If you see something, say something. When you see workers or the public being put in unsafe situations, for example, when you go into a store, speak up to the management of the store and let them know that there are issues that they need to address. And finally, we need to accept responsibility for protecting others, especially our kapuna, because we are 20% of our population is above age 65. So we have a major component of our population that is extremely high risk for COVID-19. Next slide. Next slide. So once these pieces are in place, and I'm not saying they are yet, but once they are, how do we make the transition to reopening Hawaii? And with that, I'll turn it over to Sumner.
Okay. Aloha e kakau. I just want to thank the organizers for inviting us today. It's a great honor to speak to this group, and I look forward to your questions. Next slide, please. Well, the Hawaii economy, I think by any description, it's moving deep into depression. We have a total shutdown of the tourism economy. Tourism economy accounts for about 23% of our output every day. That's about a quarter. It's about a quarter of the total output. Typically in the islands, we have 249,000 tourists here each day who are spending money and allowing the rest of us to earn incomes. Now, that means that the economy's fallen by at least 23%. And there's been all sorts of other businesses that cater to our residents that have also shut down or have been very severely reduced in their scope. My guess is that we're seeing output declines of around 35%. This is much larger than ever occurred during the Great Depression. Compared to the 2.26% decline in real GDP in 2009 during the Great Recession. This is an unimaginably large decline in the Hawaii economy. We've got unemployment at over 25%, and at least in the short run, it's likely to increase. Roughly half of this is due to the tourist shutdown. Other half is due to changes in the economy serving residents. These PPP loans, which could turn into gifts from the federal government, this could help some businesses bring back employees to qualify for this relief. But we're still going to be left with an extremely high unemployment rate as we move toward the end of the year. And our new UHERO business survey shows that the most vulnerable people are the ones who are most likely to have been laid off. And this is something that should cause us a lot of anxiety, because the most vulnerable people are the ones that have the least savings, are the least able to adapt to a crisis like this. I want to emphasize that this crisis is really different from earlier economic crises. And the reason why is that in this case, the state government has taken deliberate measures to put the economy to sleep. I mean, it's actually tried to slow down the economy. It's done this in order to restore the health of the population. Okay, now the main short-term problems for governments, all levels of governments, are to provide relief and to control the epidemic. The longer-term problems are a little bit different. The longer-term problems are to provide stimulus and to reopen the economy. And then both the local, state, and federal governments are going to be faced with reorganizing governmental services and amending the regulatory frameworks that govern a lot of our business activities. Next slide, please. Okay, so federal and state governments. So how are they de facto? I mean, this may not be the way that the responsibilities were supposed to be assigned, but how are they dividing up the tasks of controlling the epidemic and providing relief? And the way that essentially it's been assigned is that the federal government is providing relief and targeted assistance to people who've been affected by the epidemic. This is probably not a bad assignment, because the federal government has the ability to borrow trillions of dollars in financial markets and essentially to print money if they have to. Printing money just being that the Fed would go ahead and buy bonds that governments issued to cover their expenditures. The state government has been left with the responsibility for managing the epidemic within their states. It really is up to the state government at this point, and county governments, to figure out how to stamp out the epidemic, how to crush the epidemic. And then they're also left with the responsibility of trying to decide how to reopen the economy, how to relax the stay-at-home constraints and reopen the economy. And then we have these contested federal responsibilities that so much the news is about, where the feds essentially have been most of the time denying their responsibility to facilitate production, qualification, distribution of testing resources and other PPE and medical equipment. And then every once in a while they take on the responsibilities, they try to shed them again. Okay, so next slide, please. The state of Hawaii planned to reopen the economy. Well, we're a little over a month into the shutdown now. We still haven't seen the plan. We know there's a group that's working on it. I think there's some expectations that sometime soon, within the next week to 10 days, that we're going to see the plan. The governor has assigned Alan Oshima, who's a longtime executive at Hawaiian Electric Industries, and Dr. Mark Mugaishi, who's an executive at HMSA. They're essentially leading the efforts to put together a plan for the state of Hawaii's response to the coronavirus epidemic. You can see more details at the website listed on the slide. Plans are important to some extent, mostly because when governments put forth plans and say what industries are likely to be open when, even if when doesn't have a very exact time frame on it, it does help businesses try to figure out, are we going to be opening relatively soon, or are we going to be opening up way down the road? Most of the reason why these plans don't have much time frame in them is because they're also dependent upon just how the virus progresses in the state. The plans for economic reopening are dependent upon how the epidemic proceeds. A lot of these plans have 4 or 5 opening phases. Phase 1 would be like lockdown. Phase 2 is where lockdown is slightly relaxed. You have a phase 3 in which certain activities that are relatively easy to maintain social distancing are opened. There might be a stage 3 then in which activities are open that require more close personal contact and have more crowding dimensions. And then stage 4 is activities that involve larger crowds, such as concerts, conventions, large sports events would be opened. I think that one thing that has been good in this state is that there has been transparency and open televised meetings of the Hawaii House and Senate special committees on COVID-19. Those televised hearings have given a lot of information to the people who watch them. I would note too that in Australia, meetings between the Prime Minister and the premiers of the 8 state governments are also public, and they're televised also. People can watch and see the negotiations between the Prime Minister and the premiers. And then what happens is a unified policy proceeds where the prime ministers and the premiers agree on what the national policy is going to be and what policies are like and what differential response is needed in each of the state governments. Certainly our 4 mayors and governor could follow Australia's lead and televise their meetings where they're coordinating policy. I think that would really help to reassure the Hawaii public that we're moving in the right direction and in making progress toward the public policies that are needed to reopen the economy. Next slide. Okay, so principles for reopening the economy. You know, I think the very first thing we just have to admit is that opening the tourism economy is going to take longer than the non-tourism economy. But at the same time, planning for the tourism reopening needs to occur ASAP on a dual track. Even though it's going to see results further down the road, it's really necessary to have very intense planning going on now. I think that as we do more opening, what that means is that we're going to see more people who are coming in contact with each other. And even if they do that safely, there's still going to be some chance of infection. If at some point the public transited to the use of more effective surgical masks when they become widely available, and I do expect they'll become widely available over the course of this summer, if we make that transition, that might really be a very positive thing, as we're able then to have more social interactions that are actually less dangerous per interaction. I think virtually every expert that has looked at the reopening of the economy believes it needs to be gradual, well-monitored, and coordinated. The gradual and well-monitored is really necessary because we're really in a phase of trial and error. It's not to say that we don't know what we're doing, but we're really not sure if we do certain types of opening, whether or not there's going to be an outbreak. And if there is an outbreak in places, we need to monitor that, try to figure out what the source of the outbreak is, and see if there's other activities that would also be the source of outbreaks. We may have to kind of take 2 steps forward and 1 step back at various points. But trial and error is really critical, and trial and error involves monitoring. We can also, in some sense, we're a second mover. There's countries that proceeded before us, first movers, and a lot of those first mover countries that had the epidemic first, like China, Germany, Italy, Spain, Singapore, they've all taken some activities to do opening, and we can learn from both their achievements and from their mistakes. This is particularly important because it's a novel coronavirus. We are all learning. Trial and error is really important. And I think in all the principles I've seen for reopening the state economy, they're all dependent on vulnerable populations being urged to stay home until somewhat late in the opening process. This is certainly something we're not quite sure what this is going to mean for economic reopening. There's a lot of spending by the portion of the population that's 65 and above, and that's 18% of the Hawaii population. 18% of the Hawaii population staying home is probably likely to spend less money. There may be other people too, even when we do reopen, who feel vulnerable or are just cautious and may stay home more. That may also dampen the economic response to reopening. Next slide, please. Okay, so the key to reopening really is reorganizing business operations. And why reorganization? Well, the simple point is to meet demand for safety by employees and customers. And then what we're going to find across various industries is the capability to reorganize varies across businesses. Some are going to be able to some will have to radically reorganize their entire operations. But in so doing, they will find they're able to operate pretty safely. Others will have to make just some relatively minor changes to ensure social distancing. And others are going to find these changes untenable. And they will either have to wait to reopen until safer times, such as when a treatment or vaccine emerges, or close their doors. And I think there's certainly there's a reasonable number of businesses that are going to be in the situation of this last area. Again, this gives me some caution about what the response will be when we do reopen. I don't think we're going to see an extremely vigorous V-shaped recovery. We had a sharp downturn. We'll see an extremely sharp upturn. I think we're more likely to have a much slower upturn that takes us a while to recover. Next slide, please. First sectors, well, I mean, there's certainly some easy sectors where social distancing can be achieved. We have Germany opening up to small retail businesses like bookstores, bike shops, car dealers, furniture stores. You have Texas recently reopening to non-essential businesses where product orders can be made online or over the phone, and then products can be picked up at curbside. Florida has announced golfing can reopen with numerous long lists of restrictions to enforce social distancing and to make sure that fewer objects on the golf course are ever touched by anybody on the golf course. There's lots of ways to achieve social distancing. I think you're all familiar with these, and I'm going to kind of move on there, but clearly wearing masks inside businesses needs to be emphasized. You have to have spacing requirements inside businesses. And I think gloves for customers, there's a lot of businesses where Gloves were provided at the door. Cheap gloves were provided at the door. People wore them while they went around the business and then discarded them when they left. That's something that some businesses may well want to look at. We may find some businesses taking temperatures at the door. Malls may want to limit the number of parking spaces. Part of this is just that if sectors are able to achieve social distancing, I actually think there are lots of small retail businesses that could easily reopen. Next slide, please. Businesses with crowds of customers, could Apple stores safely reopen? They've been closed since the start of they've been closed since March in the United States. Next slide. Apple stores were known for their crowds pre-COVID-19. Next slide, please. In some ways, the store architecture, the new products in the store, people's curiosity about them, and sometimes just the crowds in the stores actually made the stores a bit of a destination. People walking through malls would go in just to check out what was going on. Clearly, I think Apple, that type of model doesn't really work. And I know that Apple's thinking of reopening its U.S. stores over the course of next month. It would clearly have to limit the number of employees and customers in stores to maintain social distancing. But that wouldn't be that hard to do. Mandatory mask wearing by customers, employees, that's possible. People touching equipment, people touching the iPhones and the iPads and MacBooks. Gloves might be provided at the entrance and thrown out at exit. Genius Bar was already by appointment. New social distancing arrangements, maybe there'll be separation panels as with cashiers. Less mall traffic, the Apple's going to find these stores a lot less remunerative. And it's also talking about limited hours that the stores might be open. Okay, so something like an Apple store, even though it involves some crowding, this is the type of store that if it wants to reorganize its business practices could well find itself in a position to reopen once we have some of the conditions that Tim has talked about in place. Next slide, please. Businesses involving close personal contact. I'm going to skip over this except to say one thing, and that's basically that in a lot of these businesses, there's a role for industry associations to be out there developing new standards. And then that helps individual businesses try to figure out how they might need to modify those standards for purposes of the particular type of business that they do, the particular customers that they have, whether or not, say, they're an over 65 crowd or a much younger crowd. There might be a role for employees and public and private experts to review industry's proposed standards. It would be impossible, say, for the Department of Health to come up with standards for every single industry. It's really something that needs to be done at the industry level. I noticed this morning that the Hawaii Dental Association has posted industry standards that the American Dental Association has developed. And a review of them said, yeah, this is something that's really useful for Hawaii dentistry practices. Something like dentistry, I imagine, could well open a little bit quicker than some other businesses because it already has relatively strict safety standards. There's other businesses where that's much more dubious, such as gyms, hair salons. Next slide, please. Reopening the tourism economy. Reopening the tourism economy, I think there's two necessary conditions that need to be satisfied. Tourists need to conclude it's safe to visit Hawaii. Residents need to conclude that tourists are safe visitors, that they're not going to contribute to Hawaii's epidemic. Now, step one, I think, will be satisfied sometime this spring, as long as the state moves to have sufficient testing, contact tracing, and isolation measures in place. Let's suppose that it does. Even in that case, step two can only be satisfied if residents are vaccinated or an efficient treatment emerges, or tourists are tested prior to arrival. It's difficult to see the first two options happening, so tourists being tested prior to arrival. Let's look at that possibility. Next slide, please. So for tourist testing, there's certainly the possibility of potential tourists taking a rapid same-day antigen test or antibody test before they leave for Hawaii. Tests can be conducted in a variety of different healthcare settings. Results can be sent to a cloud data server, accessible by the airline's public health authorities. If you had then a positive antibody test or a negative antigen test, the state could waive its 14-day quarantine for these passengers. But this has severe logistics. There's 10 million tourists came to Hawaii in 2019. If tourists need a test coming to Hawaii and on their flight back, they'll require 20 million tests. Today we've only done a little over 4 million tests in the United States. It's not clear that even down the road, tests are going to be available for such a frivolous activity as leisure travel. but one never knows. There is certainly a possibility that there's going to be a very large response on the supply side, that we will actually be flooded with tests at some point. I wouldn't expect to see that prior to like September, October, November. Before then, we're likely to see any extra tests that are produced go to frontline healthcare workers, to emergency providers, to kids in schools, to teachers in schools. I can think of a long list of priorities prior to tourists getting on flights to Hawaii. Next slide, please. On the other hand, testing, if tests became available, I think there's strong incentives for the airlines and hotels to work to put these arrangements together. And then government essentially could certify these arrangements. There's a lot to be said to have the private firms do this because they have incentives to keep the cost of the test down, as high testing costs would depress demand for airline hotel services. Next slide, please. So could you restart tourism with airport screening and have quarantine for those displaying symptoms? I've noticed that in some of the four-part plans that other states and countries have developed, this is part of the plan relatively early on. Certainly, even if one was going to consider such a plan, it wouldn't be viable until places that send us tourists bring their epidemics under control. Even then, we'd have problems that airport screening in Hawaii would catch most of the people with symptoms, would miss asymptomatic carriers who could spread the virus. Even if the epidemic was under control in San Francisco, people that fly here from San Francisco are fed in from all across the country, and they might come from areas of the country where the epidemic isn't under control. This is certainly a very problematic way of restarting tourism, and I fear if we go down this route that it would create a distrust of tourists by residents, lead to employee-employer conflict in the travel industry, and a decline in the already tenuous trust that residents have in state and county governments. Next slide. I'm going to skip this slide on education, skip the next slide on school reopening in Hawaii, and the next slide we'll skip on permanent. Let's stop here at the permanent scarring and trail. Just one note about, it appears if we're not going to be reopening schools until this fall. And one of the things that we know is that there's potential if we close schools for long periods, students could suffer what's called permanent scarring, that they would have less learning and earnings over their lifetime. And there's a really nice paper looking at the 1916 polio epidemic, where officials in many states closed schools in response to the epidemic. And that these kids then, if we fast forward to 1940 and look at their educational attainment in the census, they had less education than their slightly older peers, about 6% less. Next slide, please. I'm going to skip the antibody test slide because we don't really know that much about antibody tests. Well, the conclusion here, I wish I could be more optimistic, but in the absence of vaccine or treatment, Hawaii's economy, we're facing a difficult situation with recovery likely to be slow and prolonged. And at the end of the day, the demand for additional safety measures by workers and consumers is going to be a drag on the Hawaii economy that could persist for years. Still, in the longer run, we're going to find that the changed circumstances of firms, consumers, and workers, this is going to encourage waves of innovation that are going to place the economy and society really on paths we don't even know today. I do want to end on one note of optimism. And the one note of optimism is if the state could get its act together with the testing, contact tracing, and isolation protocols, then I think we could start to move to open up a variety of businesses relatively quickly. The big if is, when will the state have those procedures in place? Thank you very much.
Thank you so much to Sumner and Tim for your presentation. We are gonna turn it over and start the question and answers. We have about 20 minutes left and we have a lot of questions, so I do want to honor your time. So if we don't get to your question, we will do our best to get an answer to you after the webinar is finished. So let's see, first question that we have is, Sweden did not shut down their economy or confine people to their homes and have not shown the numbers as the rest of the world. Does this mean that the infection rates around the world have been inflated? Also, what are your feelings regarding the current stay-at-home order? Was it really necessary?
Okay, let me field that one. Was the stay-at-home order necessary? Absolutely. otherwise, quite frankly, with the number of international tourists we have coming through Hawaii, we would be in a New York type situation right now. There is no way we could have contained the spread of this virus, and we would have lost control. Sweden. Okay, Sweden's gotten a lot of attention because they're one of the few countries that has not issued a stay-at-home order. They're hoping to move toward herd immunity. With that said, they've only achieved about 20% immunity in their population already. They have a death rate that is 4 to 5 times as high as surrounding countries such as Denmark and Finland. They have seen many more deaths, many more cases than those two countries have on a per capita basis. So you can argue that their approach may have worked, but again, I think if you've got a high population density, you're going to have real problems using that approach because you are going to end up like Northern Italy, the Lombardy region, or New York. And I do think that population centers require very, very different conditions and really require the types of stay-at-home orders that we've seen to give us time to get the systems to control the virus into place. I don't want to stress this. We're not saying that this has to be here forever. We can lift the lockdown once we have the testing, tracing, and isolation systems into place. But we still need to do it carefully and in a phased manner so that we don't lose control of this epidemic again.
Thank you. Okay, next question. What is your best guess about Hawaii opening essential services? Who will define what those essential services are? Georgia is an interesting example.
Well, I think one of the things about Georgia is it's opened up lots of non-essential services. I mean, I don't see us going down quite the path of Georgia. I think probably restaurants will be one more phase ahead of our next phase. Same thing with gyms or nail and hair salons. But on the other hand, there's a large number of businesses. Retail stores where you order. Non-essential retail stores where you order via the phone or internet, you pick up at curbside. Those types of stores, I think those types of things could be relaxed relatively quickly. I think both, one of the things which I want to emphasize is I think it's reckless to be doing much relaxing until the state has these 3 protocols for testing, contact tracing, et cetera, in place. And otherwise the epidemic is just going to come back. What I'd like to see is a faster pace. A faster pace of operations by the state to get these things in place. If that happens, I think that we are otherwise on other indicators of where we are in the epidemic, or otherwise prepared to open, and that we should be planning for that opening. We should be giving businesses some type of time horizon for it.
Okay, next question is, how could we ensure that vulnerable populations are protected? For example, migrant workers and impoverished people who live in overcrowded housing, homeless, etc.
I think, first of all, the public, or I should say the government, basically needs to take some responsibility for acknowledging that these people are at elevated risk and that there is a need for programs to address their needs. I think in terms of protecting migrant workers, first of all, we would need to identify where they are, basically, and then have people outreaching to them, basically, to ensure that they're aware of coronavirus, that they're aware of the steps necessary to protect themselves, that they have the proper protective gear and the ability to access things, access to medical services, and so on. So I think there's a key role for civil society here in providing these types of services. And I think the government needs to be supporting civil society to provide those services to these populations. I think, the prison population is one I think we've got to be very careful with, because as I mentioned, California has seen a major outbreak just in the last couple of days within one of their prisons. So when we are confining people in large numbers like this, there is a potential risk there.
Okay, next question is disparity data on our COVID cases being collected by anyone, ethnicity, income status?
If there is, I haven't seen it. I think there are some real challenges in terms of how information is getting out, what information is being collected, in terms of giving us a clear picture of what's going on. I think absolutely income status information would be extremely valuable to have occupational information so that we see which occupations basically are producing new cases. that would be critical in terms of trying to guide our responses and identifying the types of locations and the types of settings where transmission is occurring. And so I think that, as I mentioned, there's a very strong need for increased transparency and openness on the part of government and better explanation to the public of how this epidemic is playing out and what's going on.
And I think that that's a great answer that leads into the next question, which is who should be doing our COVID briefings? It seems like we need to hear from other people than the usual 4 to 5 folks in state admin.
Well, frankly, I think when it comes to things like epidemiologic briefings and so on, I would like to actually see somebody who's a professional communicator actually take on responsibility for many of these briefings. That is, a public health communicator who understands public health and knows the issues associated with it. I don't think the current people who are out there doing a lot of talking are very good at communicating to the public. They are not very good at communicating messages in a succinct way. They give conflicting messages. One minute we're told that, no, we don't test anybody with symptoms. The next minute we're told, yes, we tested people with symptoms in this setting, and so on, which again, I think points to the inconsistent policies or lack of policy that we have in this regard. And I do think that HIEMA or Department of Health or whoever basically needs to appoint or design a communications team that basically is responsible for communicating to the public and getting the information out that the public needs to protect itself. Because ultimately, the response to this epidemic comes down to the public until we have a vaccine.
Okay, so the next, I have 2 questions relating to travel. So the first question is, I believe we should have universal testing for travelers, tourists, and returning residents. What do you think? We need travelers for our economy, but the second wave will come from travelers.
Well, that's also what we would both like to see. I mean, I think if we see testing for travelers, we're talking about incoming residents from the mainland, and we're talking about tourists. I think that's a way that tourism can start off in a safe, confident manner. And I say confident, it's just that people aren't looking saying, oh, tourists, I better avoid them, or even tourists coming here wondering what's the state of the epidemic. If what we have is testing and we've controlled our epidemic, we could actually be looked at as a very safe place to be. And we could find a surge of tourism here. Now, there's another note of optimism. You know, there's a lot of people that are going to be looking to travel. Their lifetime trip to Hawaii has already been put off. They haven't traveled anywhere. We're a safe destination that's isolated. It could well be that lots of tourists will come back here and want to be here. But I think that really relies upon testing. I just plain think that if what we start relying upon is just airport screening means screening once passengers have arrived here. And if we find them with symptoms, we then quarantine them. If they don't have symptoms, then they just can move out into the regular community. Certainly no tourist is going to come here off a 14-day quarantine that's actually enforced. So if we have lots of tourists going out there, I think we have all sorts of problems with the asymptomatic people, whether they're residents, returning residents, or whether they're tourists. The big question with testing is whether it's going to be practical. You know, and that's one that I just think we need to wait and see. We need to wait and see what the availability of test kits is. You know, we may find that just all sorts of people start to get on airplanes when they're not tested, or we may just find a general reluctance of air passengers to get on airplanes unless they know other people on the plane have been tested. And that isn't necessarily just for flights to Hawaii. That might also be the case for, say, New York to Boston flights, any kind of long haul flights. So we're a bit at the mercy of how elastic is the supply response for test kits. And it does strike me, it may turn out to be really elastic, that we may find ourselves awash in test kits. A lot depends on how complex it is to produce them, how easily the process is licensed out to other firms. And if those things are there, then we'll find there's lots of test kits and that this whole testing plan might work really well. If not, then there may be a lot of local demands to open up the tourism industry, safe or not.
Can I add to that as well? I want to point out testing alone of incoming travelers is not enough. Hong Kong, Singapore, Taiwan are all places basically that allowed people to return home, and all of them had major problems with resurgent epidemics because of people returning home who were COVID infected. And unless they had had the types of contact tracing and quarantine programs in place that they did, and mark my words, they were far stronger and much more effective than anything we are doing here right now. And they still had challenges in containing the resurgent epidemic with those additional people returning who were COVID positive. So I think testing by itself is not a solution unless we have the contact tracing and quarantine problem down and basically able to address and respond extremely quickly.
Okay, thank you. Next question is, what is your take on the best mix of contact tracing, including training and hourly wage needs versus Google or Apple Bluetooth tracing, including uptake and privacy issues?
Okay, first of all, the e-technologies are not a substitute for a well-trained corps of contact tracers. The countries that are doing this well, if you actually look at the numbers, they typically have something on the order of about 300 contact tracers per million population. We don't have anywhere close to that at this point. The e-apps basically can help to make their job easier. In fact, the way most of the new electronic apps are working is they're collecting information about proximity of other cell phones and then getting the cell phone number from those phones. So it gives, if the person then tests positive, they download that information, Department of Health gets that information, and then it tells them exactly who they need to contact based on their proximity and their things. But you still need to have somebody do the contacting. And it is best actually still to have human beings doing that contacting, because if you just get a text that says, oh, go lock yourself up for 14 days, most people are probably not going to respond very well to that. So we still need the human touch involved there. So they're not a substitute for contact tracing. And we definitely need to build a much stronger capacity here and not be dependent on volunteers. We have to be able to surge almost immediately and not spend a week or 2 weeks tracking down one of these clusters. We need to wipe out these clusters within days.
Okay, next question. Have there been discussions to lessen Hawaii's economic dependency on tourism, especially because this could happen again? As we look to reopen the economy, are there alternatives such as increasing agriculture and other local-based economies that can be strengthened and invested in?
Okay, so two answers there. So the first point is that we actually have been diversifying the state's economy a bit. If we go back to the 1980s, we would find that well into the 30 percentiles was the contribution of tourism. Tourism back then was well over a third of the economy. Today, over that 40-year period, the contribution of tourism has fallen by 8 to 10%. So we actually are diversifying the economy. We just don't notice as much because we don't have that other big industry that's rising. We've had growth in lots of small industries. I think most people who look carefully at this question believe that the state ought to be looking at how it can essentially make it easier to start businesses in Hawaii. It's still a difficult place to start a business. A lot of businesses that incubate here tend to leave for the mainland after they've grown up from an infant into being a child. Before they hit that stage or they're an adult and generating lots of money, they leave. We need to be looking much more closely at just the process of business formation to figure out what we're doing wrong. We periodically do this, we kind of make a few changes, and then we forget about it. This is really the time to be thinking about that again.
Thank you. And why is it taking so long for our State Department of Health to expand large-scale antigen and antibody testing and tracing organized?
Okay, let me address that one. I think part of the challenge here, number one, is understaffing at Department of Health. Number two is failure to coordinate. As I mentioned, there are several different groups doing testing in the state. They are not coordinated. There is no agreement on who should be testing, no guidance on whether we test, for example, close contacts. And we get conflicting messages depending on which of the press briefings you happen to hear on that. So I think that's a big part of our problem. Our capacity is there right now. Bruce Anderson was announcing yesterday, we have the capacity for 3,000 tests per day. That is probably more than adequate to our needs right now if those tests are directed in the proper way. But that's going to require a coordinated strategy and a decision of who's getting tested. And we need to be sure that close contacts are getting tested, that we're doing the surveillance testing in high-risk settings, such as nursing homes, prisons, and so on, and that we basically are preparing for this epidemic with a solid testing system that will pick things up very, very quickly. And I think part of our problem has just been lack of coordination and lack of sufficient direction.
Okay, next question is there an opportunity for private organizations or philanthropists to support the cost of testing efforts? What is the viability of at-home tests that get sent out to a lab for processing?
Okay, I think the cost of testing is not really a problem at this point. I think that is to a great extent dealt with. There is private money. Scott Miskovich is putting his own money basically into doing a lot of the drive-through testing that he is doing. So certainly there's room for some of that. But I would much rather just see coordinated testing within the systems that we have to make sure that we're testing the right people, and those costs would be covered under insurance, under federal funds, under a number of different other sources. So I'm not worried about that per se. I think the take-home tests are a long way off. Okay, the problem we've got right now, the antibody tests that are out there now, which are the ones that are most amenable basically to becoming take-home tests, are bad, for lack of any other word. The FDA is basically approving tests that have extremely high false positive rates. So they are overestimating the prevalence in places like Santa Clara County, Los Angeles, and so on, and badly overestimating it. They give a lot of people the impression that they're not infected when they are, and the other way around, that they are infected when they're not. Okay, so somebody who gets told that they're infected when they're not infected may then think, oh, I can go out, I can do anything I want, I don't have to protect myself anymore. And that would be a major mistake, because the majority of the antibody tests that are widely available right now, they cross-react with common cold coronaviruses, which means if you had a common cold in January or February, you may very well test positive on one of these. You're not testing positive for COVID-19. You're testing positive for the common cold you had a couple months ago. And so I think there's a lot of risk with the home test. Honest truth, based on my experience in HIV with the time it takes us to get tests, we are probably at least 4 to 5 months before there will be reliable home test kits available. And if you doubt that, consider the British government ordered 3.5 million home test kits from China, basically ended up scrapping the entire order because they were garbage. So I think that until the testing technology is there, we're not really ready to roll out at-home testing. And so I think we're gated by the technology.
One about philanthropy. So one thing about philanthropy is that, I see two big roles for philanthropy. One is to support the civil society organizations that keep this Hawaii society together. Those organizations are really under stress. They're getting less contributions, and they play such a vital role essentially in providing social services that just aren't provided by the private sector or fall through the cracks at the state sector. Giving to them is something people should consider, but there's certainly also a possibility of giving for research. There's organizations both in state and nationally that philanthropists could think about giving to.
Okay, so I do want to honor everyone's time. We have a couple minutes left, but just to wrap up, any last words that you folks want to share with the participants?
I think, what I would recommend is, as part of the public, you have a responsibility for pushing the state to do the right things. I think our voices basically requesting more coordination, requesting better planning, requesting that we address many of the concerns that people have raised during this Q&A session. I think that pressure needs to come from us and needs to be on our legislators, on our governor, on our mayors, and get them basically to start playing off the same song sheet. Right now, we're seeing too much conflict, too much confusion over who's doing what and who's responsible for what. And that needs to be resolved, because we only have 4 county governments and the state government. Those 5 governments should be able to coordinate among each other without much problem. And I think it's incumbent upon the public basically to ensure that they are providing the systems we need to reopen the state safely.
Yeah. The speed at which the state economy reopens is really dependent upon what the state does. And that if the state moves faster, the economy is going to reopen faster. There's a huge cost. Every single day we have a massive cost. The economy is not open. We have about a $97 billion economy. And each month, that's about $8.25 billion. Every week that we're closed, that's a $2 billion loss. It's a big deal. And we should be going all out in state government to essentially get our act together so that we can reopen. it's important, and it is critically important for the public to keep officials' feet to the fire. There's a big role for the public to play.
Great, thank you so much. So just to close, I want to thank Tim and Sumner again for taking time out of your busy schedules to be with us today. Thank you to all the participants on Zoom. Lastly, I want to thank all the HIPHI staff behind the scenes helping me out to run this webinar. Please mark your calendars for next week's webinar. It will be Wednesday, May 6th, again, 1 o'clock, so 1 to 2 p.m. We will, the topic for next week is going to be Family First, How to Support Your Keiki, Learning from Home, and Coping with Stress. So again, mahalo for joining us today, and we hope to see you next week. Aloha.
Aloha. Thank you all.
Thank you.